First thing that I'd like for you to do is just to go ahead and state your name and what you were dealing with, what issues you were dealing with before we met.
My name is Lateefah. The issues that I was having was with both of my knees. I have a torn meniscus in both knees, with the right being a little bit worse than the left, and also severe shoulder pain to the point that I could not sleep on my side or sleep on my stomach.
And how was this interfering with your daily quality of life? Because you mentioned sleeping on your side, sleeping on your stomach. Talk to me a little bit more about how this affected daily quality of life.
I actually had to purchase a new bed frame just to learn to sleep on my back. I've never slept on my back. I've always slept on my stomach. And to stop me from rolling over in my sleep, I had to elevate my legs. So that was kind of hard to get used to for someone who's always slept on their stomach or their side. That was something that was quite hard to get used to. Also, health wise, with me being a diabetic, I use walking and squats to help regulate my blood sugar. If my blood sugar was high, I can go for a 30-minute walk. I could do air squats. I could do things like that to help bring my sugar down. But with my knees, I was no longer able to use that as a tool to control my glucose.
And was there any other way that the knees affected the daily quality of life, or was that the main thing?
Just day-to-day things, like if it was a set of stairs, I knew it was going to be a hard time, or I had to figure out something else. I had problems getting up off the floor. I would literally have to crawl to something to be able to assist myself to get up off the floor. I was always nervous about, if I'm out somewhere and I fall, about me trying to get up, and even just lowering myself to the floor was a problem.
When you mentioned about the lowering yourself and then the squatting aspect of it too, talk a little bit about how this affected your health and fitness, workout pursuits, just general activity as well.
I already knew I wanted to get a personal trainer, but I knew that my body wasn't even ready to start with a personal trainer.
Yeah.
So I think that's one of the biggest things that I got out of this. Now I feel comfortable moving to the next step of working with a personal trainer.
Describe a little bit more about what you've achieved up to this point in terms of either, pain reduction, just moving better, confidence. Speak a little bit more to that.
Definitely moving better. I can go up and down steps without a problem. I can get off the floor unassisted. That was a big one for me. I can do squats. But I think the biggest thing or the main thing is the recovery. If I would take a walk for 30 minutes, I would be fine throughout that walk. But by the time the day starts to, carry on, my body would get stiff. By that next day, I was in horrible pain. It would take 2 weeks for me to recover from a 30-minute walk. Now my body is recovering in one day, which means I can now push myself to do more, knowing that my body is going to recover easier and quicker.
Yeah, and that is something that's big because of the what I call resilience that builds up as we're kind of working some of those underlying structures of the knee. That you can do stuff like now we talk about like lunges and things like that, and you'll be able to bounce back quicker because of that resilience that's been built within the joint. So that is awesome. And how's life just in general changed for you since you've been moving better?
I can do more. Even just simple day-to-day things like bringing the groceries upstairs. With the shoulders, and that's one way that I strained my shoulder, was bringing things out of my car to upstairs. So that's been much easier. Even just my movement before this, I was kind of hesitant on my movement. If I turn this way, if I move this way, if I lift this way, how is that going to affect me? That's not even a thought anymore. That's not even a thought. Just day-to-day living has become much easier. Getting up and out of the bed, much easier. Cleaning the house, much easier. As far as me picking things off the ground, sweeping, getting things off and under my bed, just day-to-day life, much easier.
Yeah, yeah. How do you feel about that?
Ooh, excited. Excited. Yeah. I'm
Yeah.
excited because I feel like I'm in a perfect spot to progress to the next thing. And me moving with a physical trainer, I feel like I'm ready for that. If they ask me to do this move or this exercise, I'm not going to hesitate. Yeah.
Yeah. And that confidence, like that's the biggest thing. Like even just the way you're doing squats, kind of going into lunges a bit, that confidence is huge because now you can be able to, now that has been a strong foundation built, you can take it up as high as you want to at this point. So now, what else did you try, or who else did you see to try to solve the same issue?
So I've been having the knee issue since 2017, and I did have physical therapy through my medical insurance, but it was just like you was one in and one out, on to the next person. There was no follow up, there was no daily schedule. Like with you, almost every day there was something for me to do to improve my mobility. There was an exercise for improvement every single day, whether it was a day where I was doing upper and as far as my shoulders, or whether it was a day where I was doing lower as far as my knees. But every day there was improvement. Whereas when I had a physical therapist through my insurance, hey, you met with them once a week, you got this 30 minutes, I'll see you next week. That was it. I wasn't able to contact them if something happened throughout that week to where I say, hey, I might have failed or I might have twisted something. I'm in a little bit of pain. What should I do as far as the workout for tomorrow? I didn't have none of those options. I didn't have none of that follow through. Yeah.
Yeah, yeah. And there were definitely those times that something will happen, right? Or like a little flare up, something like that, and we were able to navigate it. So, did you try anything else?
I just had physical therapy a couple of times. I also had a steroid shot in my knee one time. The steroid shot came after a car wreck. I was in a very small car and my knee hit the dash. So at that point, I did have a steroid shot, but other than that, that was it. Physical therapy and a steroid shot. They offered to do surgery on my right knee, but yeah, no, I didn't want no surgery.
Thinking back to whenever we first spoke, or even back to the assessment, what skepticisms did you have, or was there anything that made you hesitate to take the next step in working together?
None. I didn't hesitate because I think I found you through TikTok. And I tried a few of the moves that you showed on TikTok, and those helped. So by the time we had our first meeting, yeah, and with the day-to-day pain I was in every day, I
Yeah.
was at the point to where I was ready to pay whatever, I was ready to do whatever,
Mhm.
because it was, the pain was just that bad.
You mentioned how you found me. Was there any other thing about the approach that made you decide to pull the trigger?
No, it was just that, it was just the videos I was able to watch, and I was like, okay, yeah, that helped. I could see just the slightest of improvement I could see just from doing it. Probably was two or three of the moves that you did on TikTok. And I was like, okay, that can help. But I knew that was broad. Hey, you have knee pain, try this. And I knew if I came to you, I can get something specifically for me. So that was in the decision making.
Just in terms of what you've experienced here, was there anything different? Because I know you mentioned about like the daily aspect of things and being able to change things on the fly whenever there was an issue that happened. Was there anything different from other things that you've tried or other options?
Two things. I think the app, I like the app, but also because I was doing something every day and not just once a week when I was with a physical therapist, like through my insurance, you learn these exercises. I've been doing these for 6 months. What, like 24 weeks? Yeah, I've been doing this for 6 months. So now I have these exercises down packed to where I can use them 2 years from now, 3 years from now. Whereas with the physical therapist through my insurance, I don't remember nothing the people had me did. That's just honest. Yeah, I don't remember none of that. I was like, okay. And don't get me wrong, one of the physical therapists I went to, really great. I was getting ready to go on a 1 month vacation. I felt amazing on that vacation. But when I came back, yeah, did none of that stick. So yeah.
What do you feel like was the best part of your process so far?
I think the best part, like you said, is the confidence. Like when I would come to meet with you and you show me an exercise in my mind, I'm thinking, nah, that's not gonna happen. But I knew that I was willing to try it. So for me to try it and to be able to do it after in my mind thinking I couldn't, that was such a huge motivator. And it was also like the perfect example of this is really progressing. I'm really getting better. Me getting off that floor, I was like, I'm getting better. That's like to see that progression and have it click for you. I think that's what really helped me.
There's also the aspect around the inflammatory piece, which I hope that you're continuing on with that day that we had talked about that was so good. Because I know I said it, but you're like the nutrients there, like you hit almost every one of those.
Yeah.
So you're at a really good place. We can just continue to follow that way of eating for sure. Okay. Now, I know you mentioned earlier that the doctor recommended you should get surgery on your right knee. Do you see yourself getting surgery anytime soon?
No, my cousin had surgery and now one of her legs is longer than the other. No, seriously.
Okay, okay, I got you. I got you.
And then if I feel like if I could do it naturally, if I could do it this way, and yeah, I might can get surgery and surgery might help me now, but me doing it this way, this will help me 20 years from now, right? This will give me the confidence to be able to use these exercises whenever I'm starting to feel pain. Whereas with surgery, a lot of people might tend to think it's a fix all. So no, but I don't see me having surgery. I've never had surgery in my life.
Would you recommend this process and this approach to someone that's in your shoes?
Yes. I've already recommended it to my cousin who had surgery,
Mm,
one leg is longer than the other.
mm,
And she had her surgery maybe 10 years ago. And
mhm.
she fell at her job. So, everything was covered. But even now she's back to the same position. She's back to having knee pain. And I've recommended this to her. But I would definitely, you never heard of anybody having an ankle replacement or a foot replacement. And even with the knee replacement, you could still go on to have problems later down the line. So I would definitely go this route other than, anything else. And then as far as like, yeah, I have health insurance and yeah, they offer physical therapy, but I would still prefer to pay out of my pocket and get this quality of service versus me getting the physical therapy through my health insurance.
You've done really well. Awesome. I mean, you've hit every major milestone timeline that even some earlier on, like we had talked
Yes.
about. So,
Excited.
yeah, yes, like you're in a great position to just literally just continue to move with freedom. I mean, to just feel 10 years younger, to move better, to feel better. So keep it up. Keep doing what you're doing. It's been awesome witnessing it.
Thank you.